This is Dr. Steve Horwitz with Dallas Sports Academy. There's a recent paper in the American Journal of Kidney Diseases called Kidney Injury and Repair Biomarkers in Marathon Runners, looking at the potential of kidney damage after marathon running. This article is also reviewed on this excellent page on MedPage Today with a very thorough video interviewing the lead authors of the study. A summary of the article is as follows. There were 22 participants, so it was a small study. Urine and blood sample measurements were taken a day before the runners ran, 30 minutes after they ran, and a day after they ran. What was measured? Biomarkers of kidney function that are on typical blood work called BUN and creatinine. And they also, very interestingly, looked at the urine under the microscope. What was the main finding? 82% of the runners developed acute kidney injury. That means that 82% had an abrupt rise in this blood measurement called serum creatinine, and that suggests a loss of kidney function or filtration, which leads to that diagnosis of acute kidney injury. In comparison, as an example, 33% of post-cardiac surgery, like bypass surgery, patients develop acute kidney injury. So 33% of post-cardiac surgery, but 82% of runners develop this acute kidney injury. Now hold on, what does this indicate? It indicates that there is short-term kidney damage. All the marathon runners return to baseline within 48 hours after racing. And there's some very interesting images of the urine underneath the microscope at about the 3-minute and 29-second mark of that video. All the links will be below. The damage to the kidneys, according to the authors, is definitely not just simple dehydration, and that this indicates that there's ongoing repair for days after the marathon. Now, could this cause progressive chronic kidney disease if this is repeated multiple times? Well, not allowing adequate repair time is a concern. They recommend staying well hydrated, avoiding nonsteroidal anti-inflammatories, aspirin, ibuprofen, naproxen before running. And if you have any other medical conditions, definitely talk to your doctor about it. What's my 2 cents? Recovery is king, especially if you are older or have medical conditions. Make and execute a recovery plan. That's Dr.